For more on this, let's bring in the director of urologic oncology at St. Francis Hospital, Dr. David Samadi, and back with us, Miami GOP committee woman and chair of the Capitol Hill Fight Club, Angie Wong. Doctor, I'm going to start with you here. I want to go to that clip that we heard from Dr. Emanuel saying there's no way he just got this, or he just even maybe found out about this. It's something he must have had while he was president. Do you think that is something that is most definite, or is this a type of cancer that can come on and get and intensify very quickly?
Well, first of all, let me give compliment to John, because that was a great summary of exactly what went on. He is correct that this cancer is a Gleason 9, and the Gleason 9 is basically a grading system that we use to see if the prostate cancer is low risk, moderate risk, or high risk. And unfortunately, in this case, 8, 9, and 10 is considered a high-risk prostate cancer. This kind of cancer, it takes years for it to develop. And someone like President Biden, who's been in the office, he's had at least 20 years, if not more, years of PSA screening and numbers, and also digital rectal exams and prostate exams. Now, we know that this was detected based on the report about a week ago on a nodule that they found. But the story, there's got to be more to this story than what it was reported, because people are not well in 2024 and present a year later with a stage 4 Gleason 9 prostate cancer. And I want the public to know that this is not the real presentation of this kind of cancer. It takes years. Some are faster growing than others, but most likely he's had this cancer for many years. Whether he knew about it or not, or whether he had a biopsy in the past or not, that's not clear, because obviously I'm not his doctor and I don't have access to his personal information. But the story doesn't make any sense the way it's been reported.
Yeah, those are all excellent points there, Doc. I want to ask you, treatable. Talk about it, what that looks like, the timetable. We know it's metastasized to his bones. That clearly isn't good. Talk about that.
That's a great question, because from the time of diagnosis, it takes about 5 to 7 years for the cancer to metastasize to bone, and probably another 5 years or so to die from this disease, unfortunately. This is not a curable disease, but of course, many advances has been made in this field with local treatments of that bony structure if it's only a single lesion. But the real treatment for this is a hormonal treatment, which is going to reduce the amount of testosterone. Of course, there are many side effects from this treatment, but it can slow the progression of the disease, but you're not going to be able to cure stage 4 prostate cancer. A lot of side effects from this kind of treatment, including low testosterone, low libido, hot flashes, menopausal symptom, and of course, we know that there are some mental health issues, unfortunately, and these medications can even make those symptoms even worse, can affect cardiac issues and mental health. So I hope he surrounds himself with experts and many doctors, as he should have had for many decades, given the important job that he has.
Doctor, I have a question for you. How did the White House doctor miss this diagnosis? As you had just mentioned in your report, that this takes years to develop. So we were just given a report that he was just A-OK just a few months ago. How did this all happen?
Well, you know, as a doctor, I cannot speculate exactly what's going on, but I can tell you that number one, first scenario, he may have had a diagnosis of prostate cancer, say 10, 12 years ago. We see a lot of patients with low-risk prostate cancer or moderate prostate cancer, where they tell the patient, you don't need to have surgery or radiation. This is a slow-growing disease. And over the years, they may have lost track of this cancer, and it wasn't until he became symptomatic and started having urinary issues is when they got aggressive with this biopsy. That's scenario number one. Scenario number two, and I've taken care of a lot of dignitaries and high-profile presidents, etc. A lot of times they make a wrong medical decision based on political issues. So perhaps maybe they knew about this, but the timing wasn't good, or they just didn't want to release this information, or the news about metastasis was just found, and this is what they are releasing, and not the actual diagnosis of prostate cancer, which may have been diagnosed many years ago. Right. Or the third scenario is that it's complete malpractice, and either because of COVID, But it's hard to imagine that a president, someone who, important in this country with the healthcare system that we have, would go unnoticed.
That's right.
With no PSA for a few years.
It's hard
that
to
story
believe
doesn't make sense to me. Yeah, exactly right.
Right, especially with the president of the United States. It would be surprising, again, that he wouldn't have had those, as you said, the PSA tests. Yeah. But again, the story just unfolding.
Don't want to rule anything
also,
out.
Also, don't forget, there's not one doctor that takes care of this kind of people. There's a team of us. Everybody is responsible for a certain part of it.
Right.
From top to bottom, they're getting checked. So there's more questions than answers at this point.
Great point.
All right, got to leave it there. Angie, Dr. Samadi, we appreciate you. Thanks for coming on.
We wish him well. Thank you.
We sure do.